So today I am going to discuss about the lateral palpation technique of the knee joint. I have already done anterior, medial. The next is lateral. So let's start with the starting position. What should be the starting position for the lateral palpation? The therapist position, it will remain again same in front of the patient, but it, it should be little bit opposite to the palpatory surface. Means if you are going to identify the or palpate the lateral aspect of the knee, so the therapist should remain little bit toward the medial side of the knee. Basically it facilitates the palpation technique. So now come the for the palpation. As you can see that all the landmark is already marked. So first start with the localization. Again, as we have a single bony landmark for the anterior side, that is your patella, and most of the time it is taken as a reference point or for the it is used for localization. So first identify the location of the patella, then identify the apex, and you will find this joint space or boundaries of joint space, which is made by the proximal tibial plateau and distal femoral condyle. Let's have a look over the structure which we are going to identify. Here this line is representing the proximal distal femoral condyle. This line is representing the proximal tibial plateau. This thread marking is representing the IT band insertion point. Next, this is the lateral epicondyle. This is the location of your tubular head, and this is the location of your common peroneal nerve. The next structure that we can identify very easily, that is the uh, tendon of biceps femoris. So let's start from the anterior. First identify the apex of patella, and you will find the joint space just adjacent to the apex of patella. So first of all you have to position your finger pad like this, slide it laterally, identify the joint space. See, this is going in, so you can see it is a space between two bony landmarks. That bony landmark is your femoral condyle and tibial plateau. So slide, first identify the boundaries of joint space, then slide it or follow this gap and slide your finger pad more laterally. As well as I am proceeding toward the lateral side, I just here I can feel the elastic resistance. Here the as compared to the medial side, the gap between the apex of patella to the lateral surface is little bit less because of the presence of this thick band, that is the location of your IT band. So when you slide it, you will find a elastic thick consistency over the anterolateral aspect of joint space. So here I can feel that elastic resistance, and that is because of the presence of your IT band. So this is basically IT band. Next come to the, we can also identify the lateral collateral ligament, but in different position of the knee. Basically in some position, as your knee come in the extension, it is overlapped with the IT band, but this is right now the knee is at 90 degree, so it will remain little bit apart from one another. So we can identify the uh, lateral collateral ligament separately, or this position basically facilitates the identification of lateral collateral ligament. But for identification of lateral collateral ligament, first of all, we have to identify the location of your lateral epicondyle. So again, the same procedure will be repeated. Can use 3 to 4 finger of your hand, flat grip. First you have to place it like this. Perform a circular palpatory technique. Identify the most prominent part over the lateral femoral condyle. That will be your lateral epicondyle. So this is the most prominent part of the femur. Okay. So here first you can mark over here, that is the location of your lateral epicondyle of the femur. From here, vertically slide your finger pad downwardly, identify the joint space and concentrate the force or direct your force more over the anterior side or just over the tip of the finger pad. Like this, make a grip like this and then perform a transverse palpatory technique. So you can identify elastic consistency or a band over here. If you are not able to identify it, then you may just your position or you just keep your finger here and you have to position the patient in figure of 4 or Patrick position, means you can keep the leg means ankle or the opposite knee, and that will lead to the tensile stress over the lateral side of the knee and your joint become opens up, and this position will facilitate the or lead to the separation of the femoral condyle and tibial plateau, and the lateral collateral ligament become tight and you will be able to identify it very easily. So this is the method of identification of your lateral collateral ligament. At the same location, means over the absolute lateral side, first again identify the joint space and then slide your finger pad downwardly with firm pressure like this. Ultimately you will reach over the elevated bony elevation or elevated area, and that is basically formed because of the presence of tubular head, and as well as you will reach over here. Just confirm it from the anterior and from the posterior side. Just apply a pressure from the anteroposterior direction and you can identify the anterior margin of the tubular head. Same way from the posterior side, if you are applying a pressure like this, so you can identify the posterior margin of the tubular head. So just mark it like this. Next structure that we can also identify over here, that is your tendon of bicep femoris. So again you can see it is again already marked, but here in most of the cases you just have to place your finger like this, just proximal to the knee joint line, and perform a transverse palpatory technique, or your grip should be perpendicular to the orientation of the tendon. If you are not able to identify it, then just apply the pressure from the posterior side of the ankle and you can observe it is getting prominent. Relax, again do it, you can see. So over the posterolateral side of the thigh, you can palpate this thick tendon, and if you follow it, ultimately you will reach over the fibular head. The next structure is your common peroneal nerve. So just follow the margin of the head and ultimately you will reach over the neck of the fibula. Here same for the peripheral nerve palpation, you have to make a grip that is called the guitar string palpation. So you have to more focus over the anterior side of some parts of the nail, or you can say the tip of the finger is used with firm pressure. Again here you will find a elastic band like consistency, or if you maintain this firm pressure over here, soon the patient will complain of abnormal sensation in your lower leg. I forgot to discuss one more structure, that is your Gardi tubercle. Basically the Gardi tubercle, this is the location of Gardi tubercle or the anterolateral aspect just distal to the joint line. And basically this is the area where the IT band inserted. So here you can easily identify a rough bony elevation that is called the Gardi tubercle. But because of the presence or because of the attachment of this IT band, here the consistency will be mixed type. So this is all about the palpatory technique of the lateral.